All right, good evening, everyone. It's another beautiful Friday evening when you and I get to talk to each other about almost everything actually, that has to do with your health and mind. It's Your Health 360, only on Invicta 98.9 FM. Good evening once again. You know, there are very few things that make a lasting impression on anyone that you meet, like how you made them feel while you were there. Yeah. And one of the things that make that kind of impression, albeit a very nasty, let's say leaves a nasty impression about you, is odor. And even out of the odor, the one that comes forth from the mouth is especially telling about you. Well, guess what? Tomorrow is the 20th of March, right? Well, tomorrow is Oral Health Day. And this year, they say be proud of your mouth. It is telling about us as a people that when I was discussing this with some friends and colleagues, someone said to me, I've never been to a dentist before, never. And I looked at them in amazement, like, never? He said, never. And I know that a lot of us fall under this category. How important is our mouth, though? Well, this evening, let me just quickly announce that we're live on Facebook, so you can please go there, drop your comments. I look out for comments, and sometimes I don't get them in real time because you don't drop them early enough. If you drop those comments early enough, we can have a conversation that includes you, because when you send in your questions and I'm reading them in real time, it gives you that feeling that, okay, we're in this together, because indeed we are. It's our health that we're talking about here. So please go on Facebook. Don't forget to like the page and then drop a comment for me on the live video as is right now. If you don't want to do that, or you cannot do that, but you still want to be a part of the conversation, you can send your number to 09072703270. I'll run that by you again. Just send your number the text message to the number 09072703270. Well, today with me in the studio, I have Dr. Chinoye Aluku. I hope I pronounced that right. She's a dental surgeon, and it is a pleasure for us to have you here with us at Invicta.
Thank you so much. I'm happy to be here.
Fantastic. So, I asked a question, Dr. Aloku. How important is the mouth to us? Just give us a general overview, because I think part of the parts of our body that we ignore the most is our mouth. How important is the mouth?
Wow, thank you very much. A healthy mouth is a gateway to a healthy body. A healthy mouth signifies a healthy body because the body is part of the mouth, right? So the mouth is used to eat, to speak, to swallow. The mouth is used many times in a day. See how many times in a day we put things in our mouths. You take water, you chew this, you snack, So the mouth is very essential. But the unfortunate thing is we forget to take care of our mouth as we should. People are not really aware of, okay, I need to go for a checkup until something happens. And a stitch in time saves 9. So if we agree that the mouth is important, then we need to take care of the mouth. The mouth should not be neglected. Actually, coming to the dentist can actually help to identify some systemic ailments, actually. That is very correct. So the mouth should be taken care of. The mouth is part of the body. The mouth should not be abused or neglected. We should see the dentist for checkups at least twice a year. That is the standard. So we should be encouraged to see the dentist and take care of our mouth.
So our mouth is actually important.
Very important. A healthy mouth defines a healthy body.
that was the thing you said to me that caught my attention even more when you said a healthy mouth is actually a healthy body. And, you said it could also be, if you take care of it enough, it will show you things. It can be an indicator to your health. And I would like for you to explain more to us how our mouth can be an indicator of how well we are inside our bodies.
All right, the mouth can be an indicator because in the mouth, we can actually notice several things. In the mouth, if there's anemia, if there's paleness of the mouth, maybe the tongue is pale, inside the buccal cavity, the cheeks are pale inside, it could actually signify, okay, this person, you should go for some blood checks. Let's see what's happening. Or you have bleeding gums. Bleeding gums can be due to lack of vitamin C. We call it scurvy. So if there's nutritional deficiency, we can actually notice it in the mouth. And then I've seen several people, they come to the dental center, your teeth are shaking. One of the first questions is, are you diabetic? And if you have actually gone to check and actually found out that they are, the blood sugar is higher than normal. So several things, even stress can be noticed in the mouth. Some people have worn out tooth surfaces. You see the molars, those posterior teeth, they are worn down because of biting, clenching. Even we call it bruxism. Sometimes they are sleeping, they are just making sounds with their teeth, they are grinding. Could be a source of a sign of stress, And then even in the mouth, if the mouth is too dry, probably the person is not taking enough water, dehydration, and we should take enough water. It's good for immunity, it's good for preventing mouth odor, it's good for stress relief. In the mouth, we can actually notice even there are some spots, we call them Koplik spots, purplish spots like that, indicative of HIV. Even in the mouth, we can equally find out that, okay, this person, are you smoking? Your teeth are discolored, you have mouth odor. We can actually signify, find out, okay, you are actually smoking. Then we start advising, stop smoking, a myriad of reasons to actually stop smoking. So in the mouth, we can notice several things.
That it will tell you that
yes,
there's something you need to
do a further check.
Further checks on this person.
And follow up, yes.
Now, there was something also quite telling that you said to me while we were talking before we came on air, where you said, bad hygiene, bad oral hygiene could actually lead to heart problems, cardiovascular problems, could even lead to more serious problems like stroke and the rest of it. Walk us through that. How can poor oral hygiene lead to things like, a bad heart or even septicemia, like you were talking about, having infection, go through your body and all of that? How does that happen?
Researchers have proven that there are some, we call them markers. They call them biomarkers because they are signs of inflammation. When the gum is really inflamed, you have bleeding gums, unbrushing, your teeth have started to shake, the oral hygiene is very poor. It's actually something that leads to inflammation in the mouth. And then all that inflammation has actually been proven to cause systemic inflammation, to be reflected in systemic inflammation. There was actually a study that showed that 94 people with very poor oral hygiene, after scaling and polishing, they noticed the findings show that the biomarkers in the system actually went down. There was a reduction in these biomarkers. And these things, they cause things like cancer, diabetes, they cause other things. Even bad oral hygiene has been associated with preterm babies, with rheumatoid arthritis, with...
Wow.
Yes, related to the things that actually affect the teeth can actually be related
can cause for you to have a baby preterm.
Yes, researchers
That is to have a premature baby.
Yes.
Wow.
And then there are some microbes in the mouth, streptococci, different types. Somebody that has a faulty heart valve, when the brushing dislodges microbes into the system, some can actually lodge in the heart some can lodge in the heart and lead to other things. And of course, researchers have proven that strokes and heart attacks can come from periodontitis, which is when there are mobile teeth due to poor oral hygiene and some other causes. So they're actually related.
Let's now go back to the basics and start to ask you, how many times should we actually wash our mouths a day?
Yeah.
What's the ideal?
Twice a day. First thing in the morning, last thing at night. Yes. It should actually be twice a day. And when we brush, we should not forget to brush the surface of the tongue. Towards the back of the surface of the tongue, there are some hairs. And those hairs, if they're not cleaned out properly, they can hide bacteria, which causes mouth odor. So brushing should be twice a day. Not only brushing, even use of dental floss. Dental floss are these waxed whitish threads that come in small packs. They can be used with the fingers to remove the things in between the teeth that the brushing cannot actually remove. So flossing is advised at least once a day. Like some people use toothpicks. Toothpicks are not advised at all.
They're
actually,
not a good thing.
They are not a good thing because...
So those of us who cannot afford floss, dental floss, what do we use then?
Dental floss is actually about 500 per pack. I know not everybody can afford that.
Exactly.
There are some other things which I'm not sure I should recommend at this point. Some people will stretch a piece of nylon and then use it because they can't readily. It's not everybody that can actually afford dental floss.
Yes.
But we should avoid toothpicking. Some even use needles, some use toothpicks, some use brooms. And then you now see bleeding. The size of the space will get bigger. There will be mouth odor because more foods pack into these pockets. We call them pockets, yes. So dental flossing is the way to go. Food packing, yes, not in everybody, but people should still use the dental floss because not all can be removed by toothbrushing. Not all can be removed by toothbrushing.
No matter how much you
yes,
know how
and
to
lack
brush.
of flossing can actually cause mouth odor because in between you see meat fibers, fish fibers, and some other things that we see. They should be
trapped in between the teeth.
Yes. And of course, after eating, we should rinse out our mouth. We should actually rinse out. Or at the end of every meal, take a fruit. It helps. The fiber in the fruits help to cleanse out the mouth, give a better breath, so that whatever you eat doesn't follow you around. Not everybody is interested in that you ate moi moi or you just finish eating fish. No, they don't want to know. We just want the fresh breath.
The fresh breath.
Yes.
Now, it's at this point, Doc, that I'm going to go a little bit political and ask why the Dental Surgeon Association, I am supposing that you have something like that,
yes,
and there must be a Kaduna chapter. Why don't we have you pushing to stop restaurants from having those kind of toothpicks? Because the toothpicks you just said a no-no to is what, not only do we use millions of naira to import from a place like China, we also have them on tables in restaurants. Why? I mean, one would think that the Dental Association of Nigeria would push for things like that. Stop restaurants from putting these things within reach of people. In fact, fast foods use that particular toothpick, the wooden toothpick, to hold your napkin together so that when you finish eating junk food, then you now wound yourself with wooden toothpicks. So we're appealing to the dental surgeons of Kaduna State through you to do something about, the proliferation of these toothpicks, because if they are actually useless, not only useless, they're actually hazardous to our health. I don't see why we use millions of naira to import them into the nation when they're of no use.
Yes, you're right. We should actually do something about it because it's like the norm. Every restaurant, like you said,
yes,
they wrap them
fast
in tissue.
Food, restaurants, it's all over the place. This wooden toothpick.
I think it's ignorance, the awareness of the hazard.
You're supposed to educate us.
No, we are going to do that. We are going to. It's very important. It's actually a good point you are raising at this time because people are going on destroying their teeth, bleeding their gums, enlarging spaces, and having mouth odor because of the enlargement. So we have an association, and we're going to try
Please,
to do something
Dr.
about
Aloku,
it, to
take
raise
our
the
message.
awareness.
Yes,
To raise the
please.
awareness, education, information, so that the right thing can be done. It's never too late to do
Never
the
too
right
late
thing.
to start.
Yeah.
Never too late to
Never too
start. A
late.
lot of money going into importation of toothpicks.
Unfortunately.
And here it is harming the population. So please take our message back to the Dental Association. It's part of what we would thank you for in the future. Talking about things that we should know, what about how often should we change our toothbrush? Do you use your toothbrush until it falls apart? Or whether or not it still looks good, there is a duration?
Yes, there is a duration. The toothbrushes should actually be changed every 3 to 4 months, depending on how it is, because there are some that, in a short while, they're already flaring out. Instead of the bristles going vertical, going straight up, they start spreading out. That is an indicator. Take a look at this thing, change it. So the toothbrushes should be changed 3 to 4 months. Yes, 3 to 4 months is just ideal. We shouldn't even wait until they start turning to cloth or start flaring out. I don't think they are very expensive, and then we should try to change 3 to 4 months, because the essential thing is maximal cleaning. And the efficiency is actually less as time goes on. Yes.
So in a year, someone a person, taking myself for an example, I should actually have changed my toothbrush 3 to 4 times in each year.
But most people don't do that.
A lot of us don't.
A lot of us
As
don't
a matter
do that.
of fact, I was thinking it was just twice.
No.
So we
About
we
3
learn
times.
every day.
About 3 times. About 3 times. And then one thing is, when we brush, some return it to the packet. No, the moisture will actually encourage bacterial growth. It should actually be aerated. Yes. When it's aerated, it's dry, then you can keep it back. You can return it to the pack in the evening, but not immediately after brushing. We pack it and then no.
Put it in the that pack where your toothbrush is supposed
and
to.
One thing I equally like to advise, the use of mouthwashes. Yes, after brushing, the use of mouthwash can actually be beneficial. It leaves a minty, better flavor for the mouth. But it shouldn't be used for children less than 6 years, because they cannot rinse out properly, so they don't start swallowing the mouthwashes. Yes, and there are many brands of mouthwash, but the one that leaves a strong flavor to last for some time should be
Do we
used.
have natural mouthwashes? Because right now, doctor, with the economy of the nation, not too many people would naturally think about the mouthwash, the factory made mouthwash, because that money that you're using to buy just the one mouthwash could actually put a meal or 2 on your table. So are there natural mouthwashes that you would recommend? I mean, something that we could do at home that would work for us. I mean, there doesn't have to be, but if there is, would love to.
Well, one thing we recommend is intake of fruits after eating. It does a lot. I wouldn't say apple, but orange, pineapples, they are actually essential, both for the nutrients, the vitamins they give for healthy gums and for immunity, and for freshening the breath. As per natural remedies, well, herbal things are a bit controversial, but I know these mint leaves can actually leave a good flavor in the mouth. Taking things like lemon tea, lemongrass tea, they can actually leave a good aftertaste in the mouth.
In the mouth.
Yes.
All right. So let's talk about what we were born to see our parents using, the chewing stick. How effective is the chewing stick? How effective?
There are many chewing sticks. They are not commonly used again. But the thing is, chewing sticks will not leave that nice flavor, that nice after effect in the mouth. Yes, it is fibrous, they use it, but they don't have the freshening effect which a toothpaste that has flavor will leave behind. So the mechanical effect, yes, but after that, a good smell doesn't linger from the mouth. It doesn't, yes. But they have medicinal effects. Yes, they reduce oral bacteria. They can reduce gum swelling, but it's not that effective as per the smell after. Mechanically, yes, just like
So
I
just to be
mentioned.
clear, if it is cleaning out bacteria
Yeah.
and ensuring that you have a clean mouth, the chewing stick is as effective as toothpaste. But when it comes to the kind of odor that will come forth from the mouth, it might not be as effective as a
No,
toothpaste.
it's not as effective as it. You know, the toothpaste have been composed of different things. Yes, different things to reduce decay, antibacterial, as well as the smell. So the toothpaste it has been composed of several things to serve different components. But the toothbrush is mainly mechanical and some form of bacteria killing effect as well.
So I did say that people should send in their questions so that we're having a real-time conversation with all those who are listening to us. We'll open up the phone lines, but you can actually send in your questions. And already Kefas has sent in his. And Kefas is saying, please, doctor, I brush my mouth twice a day, but I still have brown teeth. Please, how can I get rid of this brown?
And regular scaling and polishing. And from diet,
From smoking, those ones can actually be washed out. Then if it's natural, I seem to leave it like that. Some bleaching, but some bleaching can actually have side effects like shocking sensations, so on. So it depends on the cause. He needs to visit the dentist. Let's see the kind of stains there are. Yes, and then there are even some genetic factors that can cause some kind of discoloration. Yes,
right.
then the discoloration, is it generalized or is it localized to certain teeth? What are the causes? Some form of trauma. There are different causes of discoloration.
So at this point is where I would like to ask, what is the normal, what should a natural and healthy teeth look like, set of teeth look like? What should it look like? Should it be pure white, or should there be, that tinge, like creamish with a
Yeah.
tinge? Because I think a lot of us, when they say white teeth, a lot of us get this
Or you see it in adverts,
in adverts,
billboards.
and then you just see that sparkle, cling.
Wow.
So
Envious.
what's the color of a healthy set of teeth?
I wouldn't say pure white. It depends on the natural, what the person is born with naturally. Just like I said, very dark people have been seen to have whiter teeth, close to pure white actually. And then fair people, very fair people, even most white people, their teeth have a yellowish tinge. See their complexion. So if the teeth are getting darker with time, of course, aging can cause it. But if there are things that are now changing the color of the teeth, we should actually see the person. I wouldn't say pure white. Yes, maybe a slight tinge of yellow, generalized, but it just depends on what the person is naturally born with. There are different shades. Yes, that pure white set, we all want it, but not all have it, and not all can get it. Not all can attain that. Yes, no matter how dark you are, it doesn't mean it's going to be. But regular scaling and polishing can actually do a lot, especially with the ultrasonic scaling. Yes, the machine, that one can remove more microbes, can remove stains, and can actually give a good after effect appearance-wise.
All right, we're sending in a text message I thought I saw somewhere. All right, so this one, the text message says, doctor, what causes difficulty and pain when chewing or any hard food? Could it be because of the artificial teeth I'm losing my teeth during football? And this is coming from Haruna. Thank you for your submission, Haruna.
Okay, I don't know whether he was having the pain before using the artificial teeth, but it sounds as if...
So if the artificial dentures that are removable, if they are not impinging on the gum, there could be other causes. There could be a fracture around. There could be pockets, food packing. When people use toothpicks, the spaces get bigger, and then later they chewing. Some say the food gets painful, and then after removing with toothpicks, then they feel better. So that encourages them to use the toothpicks. But he shouldn't have pain on chewing. It's not thin. He needs to show up. So it's causing it. Is the child, does he need changing? Is there car around? Are there pockets? Then I would advise him to just pay a visit to the dental center.
Right,
Yes.
right.
Kaduna
Okay.
State
Okay, Kaduna State Dental
Dental
Center.
Center inside
All right.
Castle
In
Complex.
complex. All right, we have Sunday Bello again. Good evening, doctor. On toothpicks, if I cut a stick, me from using
Yeah. Toothpicks go in between the teeth. They go around the gums. The chewing sticks, they are bigger. You can't compare the two. One is pointed. Pointed for what? It will enhance trauma, while removing the... So you can actually use chewing stick, yes, better combined with toothbrushing. But to use toothpicks, it is traumatic, directly traumatic. If I chew with the chewing stick to have trauma, but if I use the toothpick and poke into the gum, yes, be enjoying the feeling, yes. But then I'm causing harm, I'm causing trauma, I'm causing injury, in pocket size.
right.
Yes, and chewing sticks will not cause enlargement of spaces or mouth odor as such.
Because you're actually brought
You
over
are
a large
brushing
area.
over a large area. Yes, over a large area. But speaking, there are different sizes, so different functions, different outcomes.
Outcomes. Right. So quickly before we go on a break, there's something you talked about, and I'd like for you to educate us more about how we can stop that. This people who grind their teeth during sleep, are there dental solutions for people like that available in Nigeria?
People who grind their teeth, the cause of the problem is where are they
Grinding, stress can make people grind. Yes. Usually, well, after examining, we look at, what is the cause. If it's stress,
Because strengths, you can talk stressing, but because you have to treat from different angles.
what is causing the stress, just find out one or two things, or you can ask the
What about
spouse
when
how
you see this in children?
it's not money, children.
I had, when they were, much younger, I heard it, to read up on it. They were talking about plates,
Yes.
plates in the mouth, which I did not get,
Those are not
come on.
they
That's
are
what,
not common, but they can actually be done. They can actually be done because when the upper teeth are biting on the lower teeth, especially doing say grind, they cause sensitivity eventually and reduce the height of the teeth. So the use of the coverings or the plates is actually advisable. Really
plate just to, but that is prevention. Why in the first place?
because you can't wear plates. Can't wear plates for too long. Yes, but if the teeth are now grind to the extent that they are now looking too short,
Still with us in the studio, commemorating World Oral Health Day. It's actually on the 20th of March, and we're talking about being proud of your mouth. Are you proud of your mouth? Let's go on a quick commercial break, and we will be back still with Dr. Chinoye Aloku in the studio. Stay with us. Your Health 360.
All right, good evening once again. Welcome back, to all of us still talking about your being proud of your mouth. I was about to say your health 60. Can you imagine? Being proud of your mouth. Very, very important for us to keep our mouths healthy. And we've been talking with a dental surgeon, talking about Dr. Chinoye Aloku. And she's been telling us how important keeping our mouth healthy is. Dr. Chinoye is still with you before we open up the phone lines.
what causes mouth odor? I know you've talked about food being trapped in between the teeth, but for a lot of people, they will tell you that, look, I brush and I brush well, but I've had my partner or someone close to me enough, someone close enough to feel comfortable telling me something like this, that there's a problem, the mouth is not giving off good odor. What causes it? Because I'll tell you that I was in the bank about 3 days ago, and a young man, because I had to turn and look at him, a young man who came to stand in the line behind me opened his mouth to ask who he could stand behind, who is the last person here. And the smell that hit me from behind, I had to turn to look at him. And I would not like to think that this young man did not brush his mouth. This goes beyond just brushing. What are some of those things that cause mouth odor?
Yes, as I earlier mentioned, food packing cannot be ruled out. Cavities, that means tooth decay, cannot be ruled out. Use of artificial tooth replacements like bridges can actually cause mouth odor. If it is not properly done and the gums around are swollen and food is packing around, can cause mouth odor. In the mouth, there are different causes, but beyond the mouth, there are other causes. If there is prolonged nasal infection, if there's sinusitis, if there's infection around the respiratory passages, prolonged coughing, there's abscess formation somewhere around the respiratory area, it can actually cause mouth odor, because especially if there's blockage of the nose, yes, then the air doesn't flow in and out properly, it can cause mouth odor. Then there's some digestive tract issues that can cause mouth odor, like even undigested food remnants, people that eat late at night, eating and then just going to bed. The food will not, for some people it's a habit, the food will not digest properly and it becomes a habit, it becomes habitual, and then the mouth odor lingers. There are some infections, there are actually some disease conditions, prolonged diabetes, poor control of blood sugar can cause mouth odor. Advanced kidney, liver problems, they can cause mouth odor. There are different kinds of mouth odor. Some smell fishy, some smell like physical blockage of the intestinal tract, some smell like urine or ammonia. It depends on what's causing it within the system. The commonest cause of mouth odors are in the mouth. That's why we focus on the mouth. But beyond the mouth, there are the respiratory passages, digestive system, some are just systemic in the blood. And we need to focus first on the mouth. We can't overemphasize brushing the surface of the tongue, stopping the toothpicks. Of course, drinking enough water. Stress can actually bring up halitosis, because when you are stressed, you are on the go, you don't even take enough water. Water dilutes the system, it dilutes the concentration of whatever it is that needs to be washed out. So enough hydration does a lot. We need to, in the tropics, we are supposed to take 8 to 10 glasses per day, but how many of us actually do that? Of course, when you are fasting, there are some natural causes. When you are fasting, or people that eat garlic, they can actually have some kinds of mouth. People that take proteins without drinking enough water, because you take all these proteins, meat, fish, you need enough water to wash them out of the kidneys. So different causes of mouth odor, and if the problem is from within, then the dental injection will not do much. Yes, it will not do much. So it depends on the cause, but I would advise on the brushing twice a day, avoiding toothpicks, brushing on top of the tongue, enough water, drinking enough water. Then if you have pronasal blockage,
Nose is blocked for some, of course you have mouth odor, the system is enough. Then avoid late night eating. Then if factors are ruled out, then we can go for the other issues. Yes, check out bit of
The internal
organs. Yes, the diabetes can cause mouth odor. So if your blood sugar, if you need to go for blood sugar check, go and check.
most of us don't even, but we should at 45 and go for blood sugar checks. So the main causes are within the mouth. That's why we focus on the mouth. Defective fillings, if a filling is in place and it's shifting out, then food can pack around. Yes, and then implants and some other things that can result to infection. Yes, sometimes these implants, these are artificial restoration crude into the bone. When they are defective or there is one and cause mouth odor, but that is not in cause. Many people don't have that. So the main mouth odor is a terrible thing. It can cause lower self-esteem, relationship problems. You know, people will not tell you, but they will bag it. His mouth is smelling. So it's actually a social problem. We should be tackled more on the mouth. Yeah, scaling and polishing will help. Mouthwashes can help. Sugarless gum can help. Yes, taking things that have flavor can actually help. Yes, taking fruit after can help. But prevention is better than cure. It's hard to know what is causing it. What is causing it? Yeah. So
Now
we
we
should ask
have
ourselves.
Kefa's asking how much it will cost for him to come. He's the one who was asked about brown teeth, and he's asking how much it will cost. I told you, doctor, a lot of people. For us right now, the bottom line is cost. Is it still with the of the common man for
Scaling, you called it?
Yes, scaling and polishing.
And polishing.
Yes, ultrasonic scaling and polishing. The washing can be done manually, can be done with the machine. The machine does her job, is faster, it removes things, and it works better. So it's after the scaling. If there needs to be other things, of course it has to be done. But scaling is quite affordable, depending on, it's a relative thing. I know it's a relative. Depends on how clean the mouth is or how dirty the mouth is.
Okay, so let's open up the phone line so that those
3,000 or less. Let me emphasize. Yeah.
Okay, 3,000
or less.
Or less.
So that's a great thing. We could save towards it. I mean, hearing that, I think things are really serious. I mean, we could save towards that, even if it means for us to starve ourselves of something else. But we really need to start our dental health seriously. I was saying to the doctor that when you travel out of this nation, or even when students are going outside Nigeria, they give you a dental and mental health insurance. They don't play with those things at all. If you cannot pay it, even if you can pay the school fee, that's as good as not paying. So that means that this thing is so important that they have made mandatory for everyone. And if so, why shouldn't we? Especially when we live in a climate where things are actually cheaper in Nigeria. I know our money, some health are actually cheaper. Generally, Africa is a beautiful place. Anyway, before I digress, let's open up the phone lines for us to hear from you and to ask Dr. Chinoye your questions. Numbers are 081-4009. Once again, that's 081-40,989. Then you call the number 077-800-989. Once again, then 800-989. Quickly, ID Ikeocha. Okay, thank you very much, Kelechi. I see your message. And then Sunday Bello King, thank you, Doc, for your response. Please, how much does it cost to undergo a routine dental checkup? So, doctor has already answered that Sunday. We had let's put it in.
Mark from Marvalido.
You quickly, please.
Using of toothpick.
Yes.
Did it have any side effects using toothpick after eating?
Yes, the doctor just talked about it, but let's go again. Very, very terrible side effect. She's talked about it before. All right.
Okay, thank you.
Thank you very much. Let's take
Hello, ma'am.
Yes, hello. Welcome.
Good evening. My name is Lucas, calling from television.
You're welcome, Dorcas. Question.
Is there any specific toothpaste that one can use for like for my children?
Dorcas, even if Dr. Chinoye wants to say it, I will not allow her because the toothpaste people didn't pay us. So I'm not going to allow for us to call specific brands, but I'll allow for Dr. Chinoye to talk about what you can look out for when you're buying toothpaste. Is that good enough?
Okay.
Is it good enough, Dorcas?
Okay.
All right.
Yeah. Thank you.
All right. Thank you very much, Dorcas. Still taking your calls. Doctor, you're writing those things down so that you can remember. Let's take one call and then we'll come back to you. Hello, good evening.
Hello, good evening.
You're welcome, sir. Your question quickly.
I want to ask this question. I'm Samuel at Tukutu Road.
You're welcome, sir. Go ahead.
I said if you are brushing your teeth always, but you still have a hole in the teeth, what causes that?
Okay, if you brush, but you still have cavities, that is the hole in your teeth.
Yes.
Why?
In your teeth.
Okay.
Yes.
All right. All right. Let's come back to Dr. Chinoye. Dr. Chinoye, please answer quickly so that we can take more calls before
Okay.
we let
I'll
you
start
go.
with the first question. Toothpicks. Toothpicks are meant to dig in between and bring out food remnants. And when the digging happens, then the spaces get larger. The gum bleeds. When that happens, the spaces can actually hide more food and then they start having mouth odor. Most of the time when we actually use the toothpick, some people will say, okay, use it carefully, but dental flossing is still better. I wish those restaurants would put dental flosses on the tables. Then people will have healthier.
They should.
Then people will have healthier gums and teeth. And then making it a habit, sometimes even a sign of, okay, I just finished eating meat. You just see the toothpick hanging out of the mouth like as if it's a style, you know. But it's actually doing damage. It's never too late to do the right thing. Using toothpicks is wrong. Dental floss is better. It causes less harm. It doesn't cause bleeding like the toothpick. And it doesn't enlarge the space. And it reaches better in between the teeth. So the toothpicks is not advisable. It's not advisable, yeah.
Okay.
Of course, broomsticks, not advisable. Anything sharp is not advisable. The threads are more tender to the gums. So the toothpaste type, there are some kinds of toothpastes that are for children. You see on them, they wrote milk teeth. They are for milk teeth. They are for temporary teeth. They are for children's teeth because the fluoride in them is actually less than that in adults. When children use the adult toothpaste, like when children below 7 years use the adult toothpaste, over time, you know, children, sometimes they like licking the toothpaste. They can actually have some kind of discoloration. That is fluorosis. And when they become adults, you know, it becomes a problem. So if they can get the...
Hold on, Doc. Children can actually get something called fluorosis.
Excess use of toothpaste,
And
adult
you know, a
toothpaste.
lot
There
of
should be a
children-
size. There should be like a bean size or pea size, you know. PEA, like
Yes.
beans, yes.
Yes.
There should be a small quantity for children less than 7 years. They shouldn't be using adult toothpaste. But here, we don't care.
You
But the
just
milk
line it.
teeth is coming into the market. I mean, the milk toothpaste. Yes, they actually wrote milk teeth. It's for children below so that they don't have the fluorosis, which discolors teeth. Yes,
Okay.
which can be... It can affect the appearance
So
of
even
the
this
teeth.
person asking about brown teeth, it could actually be a case of fluorosis.
Yes, it could be fluorosis. We don't know. It could be tetracycline stains. It could be dentinogenesis imperfect. There are several
So many
things. There are
things.
several things.
Right.
Yes.
So Kefas, you need to go. But go ahead.
Yes, then the brushing and then you are still having cavities. Yes, you can have cavities. Cavities, brushing can help with cavities, but the diet, what causes cavities? The diet, that is the sugary substances that we take, especially the sticky substances. Of course, things like ketchup, even biscuits, you know, very ripe plantain, some caramel, some kind of sweets, some kinds of chewing gum can have a lot of sugar. And then when the sugar acts, when the bacteria in the mouth acts on the sugar, then it tends to wear down, softens the teeth surface, and then cavities can form. So brushing, yes, it can help, but you have to brush with a fluoride-containing toothpaste. That reduces the tendency to have cavities. So many people brush, but prevention is still better than cure. If you come and there's a little cavity, it can actually be arrested before it progresses to a bigger cavity of which you start having pain. So brushing with a fluoride-containing toothpaste, it helps to reduce incidence of cavities. Okay. The fluoride is what strengthens the teeth. But when it's in excess, of course, it's a problem.
Let's take this call, doctor. So many calls coming, and I see a text message. I'll read that. Hello, good evening.
Good evening.
You're welcome.
Thank you. My name is Francis.
Go ahead, Francis. You're welcome, sir.
Okay. I want to know, I'm having gum swelling. I want to know the causes and perhaps the possible remedy.
Gum swelling, and then the reasons why.
Okay. Maybe remedy.
Okay. Someone is asking you here, Dr. Chinonye. Thank you very much, Francis. We're running out of time, so I have to rush this. Someone is asking Dr. Chinonye, if I had to choose between brushing in the morning and brushing at night, which one should I choose? Because I hardly do both.
The person has to try and do both. Brushing in the morning, brushing at night. They all have their functions, you know. Brushing at night, then you clear out the substances that has packed over the day, you know. And flossing at night, you clear out the substances that are hiding in between. Brushing in the morning, we are more used to that. Most people don't actually brush at night. Yes, I know that. But it's highly advisable. Brushing in the morning, by the time you sleep, saliva flow is reduced. And then if there are still food remnants, they still go on to decay. And you can't just go out and say you wouldn't brush. Even at night, you should brush. So that as you are sleeping, the mouth is still a bit fresh. So I will advise to do the two. Most people will say, okay, the morning on we go with it, forget the night brushing. But the Dental Association recommends twice.
Yeah. Okay, so quickly, the man who has swelling of the gum.
Like I would say, what is the cause of the swelling? Then I like to know the nature. Is it swelling in one place or is it generalized swelling? There are many kinds of swelling. The swelling can be due to poor hygiene if it's generalized. It can be due to infection around the tooth, which has proceeded from the gum to the bone area. It can be, I wouldn't say the bigger stuff here, but the person really needs to show up. We need to assess to see if it's generalized, if it's localized, if it's due to some other things. What kind of swelling?
You need to see.
Yes, is it a growth? You know, is it something we may have to refer to, you know, some specialist? He needs to show up before the swelling proceeds further. And some people who have ulcers, anybody that has ulcer that is not healing in 3 weeks should actually show up, because it may be a signal to more serious things.
When you say ulcer, what do you mean?
Ulcer, I mean when the surface of the mouth.
When you have a wound in your mouth.
A wound in your mouth, yes. The surface is compromised, yes. Okay. The surface is compromised, yes. When there's a loss in continuity of the covering of the mouth and it's not healing in 3 weeks, it's a signal. It's a signal to more serious. It's a signal for more serious attention.
Okay.
Yes. And then people that smoke, people that take alcohol, they need to be checked because both things can actually lead to cancers. Yes. Each of them, the smoking can cause oral cancer, alcohol can cause, but then when they are together, when they are combined together, the person is at a more higher risk of having oral cancers. And smoking is totally out of it. The mouth odor, the stains, the oral cancer. And smokers have been noticed to have more tooth loss problems, tooth support problems, yes. And they have more bacteria in the mouth, actually. Yes. So the smoking is a no-no.
Dr. Chinonye, I wish we could keep you for like 30 minutes more at least. There are so many questions that a lot of people have. I want to know, for example, children who grow up with uneven teeth, do we have facility of braces now in Kaduna State to have braces for people who want to straighten, the alignment of their teeth?
Yeah, children should actually be brought to the dental clinic once they're about a year old. Once the teeth start coming out, prevention is key. So we should focus on bringing them, not to do anything, but just to see the dental chair, dental environment, you know, so that they get used to coming twice a year. Most children are brought when they either fall down, they have cavities, or some parents will say they have mouth odor, or one or two things. But children should be encouraged. There should be an inculcation of that habit from an early age. So one thing with children is that the teeth are changing.
We've run out of time, Doc. We've run out of time. Oh my God. I wish we could have you for longer, but would one of these days call you back to answer even more questions. Just send them in, and would like to thank you very much, Dr. Chinonye, for coming in this evening. It was a pleasure to have you.
Thank you. I'm happy to be here, and I hope people will visit twice a year because prevention is key.
You will see, you can find Dr. Chinonye at the hospital in Castle.
Dental Center,
yes,
Kaduna, inside Castle Complex, Kaduna State University Complex. We're
Just
still
go
there.
there.
We did not move with ABU. We're still there. And we'll
So,
try our best.
Go there and ask for Dr. Chinonye Aloku. Tell her you heard her on Invicta. She'll tell you more. Until then, until next week, already people are giving me particles. I can see you. Thank you very much for your signal. I'm off. Be proud of your mouth. Do the things that will make you be proud of your mouth.